Welcome to our weekly 3-minute therapy podcast. And Mick, do you want to explain what 3-minute therapy refers to?
Yeah, 3 minute therapy refers to the exercises that you can do using rational motive behavior therapy. And it's an exercise to find out what your irrational thoughts are and replace them with rational thoughts. You want me to explain what rational motive behavior therapy is?
Sure.
So, rational motive behavior therapy began with Albert Ellis in the 1950s, in which he realized that the way people think determines how they feel. It was originally called rational therapy, and then it became rational emotive therapy, and then rational emotive behavior therapy. And the idea is that our thoughts contribute or determine how we feel, and whenever we feel something emotionally, our thoughts are intimately connected to it. And so you find out what your thoughts are if you're experiencing depression, anxiety, or anger. You determine what your irrational thoughts are that are causing your self-defeating emotions, and you learn how to replace them with your self-helping thoughts to create self-helping emotions. Your rational thoughts create self-helping emotions. Your irrational thoughts create self-defeating emotions.
Okay, very good. And before I add to that, I just want to introduce our you and me. And I'm Dr. Michael Edelstein, clinical psychologist with an online and in-person therapy practice and a website called 3-Minute Therapy and a book of the same name. And Mick, do you want to introduce yourself?
Yeah, I'm Mick Barry. I wrote a book on stage fright with Michael Edelstein, and I've been practicing rational motive behavior therapy for, gosh, 36 years, I think, something like that. Maybe, no, 38 years, probably, something like that. So I used to have a big problem with depression, and it helped me get over my problem with depression and anxiety. I
Okay, great.
use the tools of REBT to get over my problem with depression and anxiety. I'm actually the one that did it. REBT simply gave me the tools to do it, but using the tools is what got me over the emotional problems.
Yes, and as you said, rational emotive behavior therapy was founded by Albert Ellis, and both Mick and I were patients of Dr. Albert Ellis many, many years ago. Okay, so today's subject is physical pain, how to deal with physical pain. And physical pain can be very debilitating if it's very extreme, but then you have a choice whether you're going to add emotional pain to your physical pain. And as Mick said, uh, if you are adding emotional pain, if you're stressed about it, depressed about it, guilty about it, angry about it, then you're adding to that, and your additions come from your thinking, from thinking in terms of demands, must, should, supposed to, such as, I shouldn't have allowed this to happen to me, or someone else shouldn't have punched me in the nose, or my life should be easier and exist without pain. And the more you tell yourself those things, those demands, shoulds, musts, the more you'll not only have emotional pain, but often magnify the physical pain by focusing on it and not getting on with your life. So, one of the behavioral ways to deal with this is by getting on with your life. Push yourself to do your daily activities. Don't convince yourself it's too hard. Hard doesn't equal too hard or impossible. So normally, at most levels of physical pain, you can continue on with your life in some way or facsimile. So that's some of the main ways to deal with physical pain emotionally. And then in terms of physically, consult a medical doctor, get a diagnosis so you know what you're dealing with. do research on the internet, see what you can find that are recommendations that would help you, and consider seeing a physical therapist. So those are various practical ways to deal with it. Mick, anything else?
Well, I was going to say that when we are experiencing physical pain, we want to alleviate the actual pain as much as possible. So that is not something you do mentally, but it's still important to try to do everything you can medically or health wise to eliminate the physical pain and not just tell yourself, oh, I'm going to endure this. It's not a good idea to endure something if it can be avoided. So it isn't just the mental attention that I think REBT would address. It would be to say also, is there anything to reduce the physical pain? And until you know that there is, then watch out for telling yourself, I can't stand it. It may be very physically uncomfortable, but it is still something you can stand. Physical pain can be very debilitating and very hard to deal with, but we want to try to eliminate the emotional anguish on top of the physical pain or anguish if it's that severe.
Yeah.
The thought that generally would prevent us from that would be, I can't stand it, or this should not be happening.
Yes. Or it's awful, terrible, or horrible, rather than just very, very bad, 99% bad, uh, not 100 or 101% bad. Mick?
Yeah, and I think this is one of the more difficult problems to deal with emotionally. It's one thing if we don't pass a test or we don't get a job, there's no physical pain involved with that. And so it's entirely an emotional disappointment. But physical pain can be a big, big challenge because it might not be going away.
Yeah. Yep. Exactly. Okay. Anything else you'd like to add?
No, that's about it.
Okay. So just to wrap up, I'd like to thank Chris Rossini, our tech engineer. Comment below if you have thoughts, if you have a subject you'd like us to discuss, if you'd like to come on the show with us and discuss something, either a problem of your own, a problem of a client of yours, feel free to let us know. Give us a like and a thumbs up if you gain from this. Suggest subjects in the future. And also subscribe to the 3 Minute Therapy podcast to do what, Mick?
To stay on the rational side of life.